Would you like to know more about Pentax Medical's commitment to infection prevention? Read more about our hygiene commitment on our website.
Thank you for your introduction, and good morning, everyone. I would like to thank the organizers of this event to give me the opportunity to highlight the importance of drying to reduce of biofilm formation with the use of a device that we call PlasmaTYPHOON, and also to store flexible endoscope by the device that we call PlasmaBAG. In this first slide, you can see my hospital in Nantes, in France. That is a very large university hospital with 3,000 beds, and we are performing each year more than 20,000 endoscopies. So what is the biofilm? Bacteria readily adhere to wet surfaces and form organized colonies of cells enclosed in a self-extruded matrix composed principally of polysaccharide that facilitates adhesion to an inert of a living surface. This type of bacterial organization is termed biofilm and was originally noted in 1936. The microorganisms that form biofilms include bacteria, fungi, and protists. Perhaps the most of common biofilm familiar to all of us is the dental plaque, as you know. That sticky, colorless film of bacteria and sugars that constantly forms our teeth, that we call slime on the surface of water, particularly ponds, is also biofilm. The slimy films starts forming when initially free floating bacteria adhere to surfaces in aqueous environment and start laying their roots. As you can see in this figure on the right of the slide, first of all, you can observe a single free floating bacteria land on surface. Then in a second step, bacterial cells aggregate on and attach to this surface. Then in a third step, growth and division of bacteria for biofilm formation. And then you can see a mature biofilm formation. And in the last step, that can provide infection for in or out patients with endoscopy, a part of biofilm disperses to release free floating bacteria for further colonization. Then, to stay sticky, the bacteria excretes a glue-like substances that effective at anchoring them to all kinds of material, from plastic to soil to medical implant, and of course, such as a flexible endoscope. This glue is known as an extracellular polymeric substance and is composed of sugars, protein, and nucleic acid like DNA. This means that bacteria sometimes join together, cling to essentially any surface and form a protective matrix around the group. However, it's only in wet and moist environments that you're the most biofilm. What the consequences? What are the outcomes with biofilm? However, despite their early discovery, it has only been relatively recently that their major impact on infection control has been realized, even if infection are very low. We only speak about endoscope contamination with biofilm. Biofilm can form on or in many medical devices, as we see, such as contact lenses, central venous catheters, urinary catheters, and endoscopes. It frequently result in nosocomial infection with implant loss in hospital, and can be associated with an increase in patient morbidity and healthcare costs. So what about retroprocessing and cleaning? Current recommendations for endoscope retroprocessing include a cleaning step involving immersion of the endoscope in a detergent with brushing, a larger channel and flushing of all channel, followed by high-level disinfection or chemical sterilization. We know that flexible endoscopes are complex devices, difficult to clean, but it's very, very important to clean, to dry, to store endoscope because they are reused in patients. And has the high turnover of the clinical units that use flexible endoscope, we must be careful with human mistakes in the retroprocessing and cleaning performance. So detergent containing enzymes such as protease and amylase are subject for increased efficacy in removing sore. So you can see in this slide our Nantes University Hospital Retroprocessing Center for flexible endoscopes. This center is equipped with 6 soluscope cabinets that you can see here. 7 soluscope that are retroprocessor, you can see here, and a special one for ENT activity. We also have 3 PlasmaTYPHOON, and our park is including more than 200 flexible endoscopes from 9 different services, such as gastroenterology, pneumology, ICU, urology departments, pediatrics departments, ENT departments, etc. We have also 2 robotic transport. I will show you 2 slides with those robotics transport to transport flexible endoscope between our center and the medical units. And 7 professionals, auxiliary nurse, are working in this center from 7 to the morning to 8 in the evening. We are performing more than 20,000 cleaning disinfection cycles per year. Each day, more than 100 endoscopes are disinfected, and we are performing more than 200 microbiologic samples per year to assess the microbiologic contamination of our endoscope park. So what are the key factors for our retroprocessing centers from the use of endoscopes in clinical units? The bedside pre-cleaning right after the exam, then the transport, and you can see here in these 2 photographs the two robots that we call Scopy and Maya. They perform more than 1,000 journeys per month, approximately 100 kilometers for the transports. Then the manual cleaning and brushing, then the automated cleaning and disinfection in a retroprocessor, and then a transport to store endoscope. So you can guess that we are only able to store 48 endoscope in our 6 cabinets because we have only 8 places for each cabinet. Then we need to store endoscope with the PlasmaBAG. So endoscope drying and storage. At the end of the washing and disinfecting procedure, the possibility to use a system that dry completely the channel of the ensuitments and protect it from the development of biofilm. So we can see in this photo the device, so the PlasmaTYPHOON, that is an automatic device to quickly dry the endoscope channels after disinfection as an automatic washer disinfectant machine with a drying cycle up to 1-2 minutes with the medical air. Very easy to use. instead the last systems with the medical air, with a very lot of noise and a long drying period. So we like to use a PlasmaTYPHOON because it's a shorter time and an easy use of the machine with a high level of drying. And also this machine can that we call PlasmaBAG can be used to store endoscope with a guarantee to keep the instruments disinfected in a 7-day period for the French guidelines. But I know we can improve this period to 1 month in other countries. We use a barcode traceability system to identify operator and endoscope, and we badge instruments to reduce the risk of instrument contamination during the storage and transport. So you can see here a little film. I don't know if I have time to show you 1 or 2 minutes, and I would like to thank Professor Paolo Accidiacomono from Milano. In this little movie, you can see how to use the PlasmaTYPHOON. You can see here with a connection. Okay. Then this slide to show you that we perform more than 200 samples to assess the contamination of our park of flexible endoscopy. As you can see in this graph, we improve the conform sample from 40% in 2011 when we opened our center to more than 76% of conformity. And in the same time, we decrease the unconform sample. You can see that 24% of our samples are not conform, but that concern only loaner or return endoscopes that needs to be disinfected again before be used again in clinical units. That means that many of our endoscope in routinely use in different clinical units are always or most always conform. So to conclude my presentation, we adopt this solution to an FSC PlasmaTYPHOON solution. PlasmaTYPHOON is an ultra-fast drying unit for endoscope, very easy to use. PlasmaBAG is a single-use device for active storage with plasma that completes our system, but we are only able to store in retroprocessors 48 endoscope, and we have different clinical units that are very far from our retroprocessing center. Maybe by foot you need 20 minutes to go to a medical unit. So it's why we use robotics to improve this time of transport. So we need to complete our storage by PlasmaBAG. And as you see in this slide, we use storage with PlasmaBAG for 12 pulmonary endoscopes, 30 endoscope in gastroenterology departments, 30 endoscope in pulmonology department, and 15 endoscope in the pediatric department. And we are currently trying to use PlasmaBAG to store urologic endoscope. So using those kind of device can minimize the risk of bacterial contamination through a highly effective drying mechanism for the endoscopic channels that are very difficult to treat, and to reduce of endoscope retroprocessing cycle times. Thank you for your attention.
Thank you, Professor Lepelletier. That's very interesting. I was wondering, you've been focusing very much on the drying part in your last part of the presentation. From your point of view, do you think this is still the drying? Is that an underestimated step in the reprocessing currently around the globe?
I think everyone in Retroprocessor Center know that this step is a very important step to reduce the formation of biofilm. But I don't know in France or in other countries through the world if everyone used efficiently device. So usually, as we did before, we use the medical air with a long time to dry endoscope with a lot of noise. And I don't know if this old way to dry is so useful now when we can use this kind of device such as PlasmaTYPHOON.
Okay, that's...
Maybe it will be interesting to assess how many centers use a different way to dry endoscope. But I think everyone knows that is a very important step in the retroprocessing endoscopes.
Okay, well,